Okay. Good morning. It's time to get this show on the road. I'm gonna be, let's see, going into tinting, or let's say, should I say, where's my book bag? Let me get my paper. Okay. Whew, sheesh. I'm going to do, I'm trying to decide if I want to do waxing procedure or if I want to do tinting and a day. So let's see. I'm gonna go over brow tinting today, and then I'm going to do I'll probably get into LED, and then I'll probably get into a waxing procedure. So, excuse me, I'm trying to wake up. So, I'm probably going to end up doing, trying to show how to do a bikini and a full leg, even though I can't see any full leg or bikini on my mannequin. So I will do that later on. But right now, I'm going to do lash tint, and then I'll do, not tint, I keep saying tint. Right now, I'm going to get into the, that's why. Okay, so I'm going to do infection control. I kept calling it first aid. I meant infection control. And then I'm going to do, infection control. And then I'm going to do, I guess microdermabrasion, actually, instead of the tint and lift, because I've done lifting before and my camera got cut off. So, probably get into that again later, but right now I'm doing infection control. Then I'll work on microdermabrasion fading. So, excuse me. Okay. So, for infection control, I'm going to be going over the hand washing, the, what is it called? Let me get my book again. The hand washing first aid for licensee and clients, and then I'm going to do implement and just go from there. Okay, so I'm gonna do, where is it? Another, hand washing evaluation plan. Just read how it is. So it says total time required to wash hands properly is 20 to 30 seconds. Me, I like to wash mine from 30 to 40 to be on the safe side. It says apply a coin-sized amount of liquid soap and, pause, I skipped something. It says wet your hands with under running water. So, apply a coin-sized amount of liquid soap. I always be working it. Rub your palms together. Rub the back of your head. Rub both of your hands on interlocking fingers. Rub the tips of your fingers. Rub the tip, I guess that means under your nails. Rub the back of your fingers. Get the tip, then rub your thumbs. Then your wrist. And that's it. All. Turn the water off. Okay. Voila. And that is the hand washing evaluation. And excuse me, I have to stretch. Next is the implements evaluation plan. So my tweezers. I have some tweezers. Oh, probably. Anyway, so I got tweezers on my eyes, and I'm going to clean off my implements. I take them to I take my dirty implements to a dispensary area. I locate my cleaning solution. So let's say this is my cleaning solution, and okay. And read the solution manufacturer directions. So let's say this is Barbicide, and it's telling me to make sure I put gloves on before I use. Avoid getting it into my skin to avoid open wounds. Blah blah blah. They go from there. Okay. Excuse me. Where was I? Oh, so I'm gonna take my container and I'm going to wash my instruments with a clean solution and scrub to remove. So my other clean solution is dish detergent. So okay. So and then after I'm done washing, essentially rinse them off and dry them off. So locate my disinfectant that is bactericidal, vericidal, fungicidal, registered by the EPA for use of beauty salons or salon settings. So instead of that solution being herbicide, let's see. I don't have nothing. Herbicide. Let me get the point. Read disinfectant manufacturer directions for implements. Follow manufacturer's directions for mixing. So, the implement is completely immersed in disinfectant that is bactericidal. Somebody spelled this wrong. This says vericidal and I don't think that's what they're supposed to say. Oh, vericidal and fungicidal. According to the manufacturer's directions. So, what I'm going to do is put on my gloves, take my measuring cup, and put on my goggles. I'm going to take my container and fill it up with 32 ounces of water. So 32 ounces of water, and then I'm going to go ahead and do 2 ounces of herbicide in my measuring cup. And then I'm going to, what's next? Ouch, that hurt. Then I'm going to sit my implements in a closed container and allow it to sit for 10 minutes. I'm going to time it to see, not to see. I'm going to time my implements after 10 minutes and go from there. So what is it? Remove implement from disinfectant. Oh, that's after the fact. So it's about to be 15 minutes. So we can go from there and start timing the implements in a closed area and go from there. And then we want to take off, then we want to take my disinfectant gloves, dark side gloves, clean off my dispensary area. off, wipe it off, wipe it off. And then boom. Go from there. Take off my gloves. Throw away the barber soap and my gloves. Then wash my hands. Alright. Wash my hands. Get them off. And then I'm done. Now I'm gonna go to licensee injury and client injury. Let me get my first aid kit and my little mannequin head. So, oh Lord. Okay, I forgot to wipe my mannequin off from my exam. So anyway, I'm going to be doing let me get my mannequin head. I'm going to be doing the first aid for my clients. I'm in between the service and he or she accidentally got hurt. And so, there's no commanders on it. So I am trying this off my leg. Anyway, so I'm in between the service and my client gets hurt. And I'm going to tell them to remain calm and make sure I help them out. Both my client and I will head over to the sink to wash our little hands. So, and I'll make sure my client washes their wound. I'm about to burn my hands. So, wash my hands. Oops. Dry my hands off. And after they've been dried off, I'm going to put gloves on. And after I put gloves on, I'm going to take a Q-tip and get my first aid antibacterial ointment. I'm going to clean off the wound. Not with the alcohol pad though. This would be this, but I'm going to clean it off with like soap, antibacterial soap and water. A little Q-tip swab, go around, and then after I've done that, throw it away. Then I'll get a Band-Aid. I'll get a Band-Aid and then open it up, apply it to the chin, then boom. My client is free to go back and lay down, sit down, and then I'm going to take my herbicide wipe. Alright. While my gloves are on, I'll take a herbicide wipe down my workstation. What else? Let's sterilize implements if needed. Disinfect, sanitize. Yeah, that's about it. Throw away trash. Laundry goes in the laundered, need to be laundered pile in my basket. And after I wipe down the whole sink and etc., I'm going to take my gloves in and out, throw them away, and wash my hands. So, shake, shake, shake. Ow, my chest. Throw away. Then boom, I'm complete. And now back to the implements because it's going on 1 more minute until it's time to take them out. And then it says implements are completely immersed in disinfectant. Remove implements from disinfectant using manufacturer's directions. Rinse the implement with hot water, dry implement with a clean towel. Place them in a closed cabinet or a closed container, ensuring no other implements that has not been disinfected is within the container. So I'm going to take my gloves, put my gloves on, and then I'm going to take my implements out of the water. And after I just take them out of the water, I'm going to rinse them with hot water. So, then dry them off, and I'll take my container and rinse my container out. And, oh my eyes. They hurt. And dry them off with the paper towel. Dry my retainer off with the paper towel. Disinfect my workstation again. Just to clean it off. A bunch of bags under my eyes. Okay. And then take my gloves off with the paper towel being thrown in the trash and wash my hands. Turn this off. Dry my hands. Turn this away. Now do the licensee injury. Alright, so now let's see. I had to write my no, my dry eraser went out. I had to write down time really, really quick. Okay. 30. Okay. So now let's see. Licensee injury. Okay. So let me see. Alright, so now back to reality. Licensee injury. Oh, this. Okay. So for the licensee injury, it says that I need to stop the service, just like the client injury. And I'm going to explain to the client and excuse myself. I'm going to proceed to wash my hands. Wash my hands with soap and running water and dry with a disposable towel. If area is punctured on the hand, combine the hand washing. And so washing my hands for 30 seconds. Take my paper towel. It says, if cut is still bleeding, apply pressure over the wound with the disposable towel. And once it's removed, it must be placed in the trash can. I'm going to remove a Band-Aid and an antibiotic cream from the first aid kit. So I have my first aid ointment and I have a Band-Aid. Then it says apply my bandage and antibiotic cream to the cut. And I'm going to place all my trash in the trash can. And I'm going to put on my gloves and grab my implements from the workstation and properly disinfect them. So I'll let them sit in the barber shop for 10 minutes, disinfect, sanitize. And while my gloves are on, I'm going to take my disinfectant wipe and clean off my workstation. Uh-oh. Do a minor burn. Then says let me drink some water. Clean the disinfect station just like I did, and then after that, of course, I remove my gloves and my barber side wipe. Now I'm going to wash my hands. And if my injured area is on the hands, fingers, or thumb, I'll apply protective gloves and make sure I use a finger guard. My eyes, my eyes, my eyes. And then I'm done with that, and I throw away, then boom. That's all of my infection control procedures. Now, I'm going to, oh Lord, I got my laptop lit. Okay. Now, I'm going to do microdermabrasion and MBD. But I need to run my microdermabrasion paper. That's what I need to do. So, leave that light on. So, let me see if this freaking paper is in my book bag. Hopefully. Got so many of them. So, for LEDs, where did I put the papers? It's probably always in my car. Yeah, it's the code out there. Anyway, I'm going to do LED, and then I'll do microdermabrasion. For my LED, I will use these. It's pretty cool. I'll use my highlighters and my instructions. They don't have the directions. Oh, yes, it does. Okay. So, let's see. Let me get some water real quick. Okay, I feel better. I should have made some coffee. So anyway, I'm going to be doing a facial again, but this is for LED. So it says, oh, I ain't got no water. I do got water, but I don't have a bowl. You know what? I can just use this little tube. So, I spilled it on myself. Yeah, back to what I was saying. Oh man, I need to bring the paper towels with me. Okay, anyway. So, I'm going to be doing LED, and it is light emitting diode. I think I said that right. And the LED is going to be for, the red light is going to be for skin rejuvenating, wrinkles, age spots, broken capillaries, wounds, cuts, and scars. And the blue light is going to be for acne. Okay, let me try this again. Put water in my bowl. What is my bowl? I'm going to put water in my facial bowl and perform a facial and do LED. If I can find it. Yeah. Okay. So, I have my client, and I'm going to prepare for their facial, and then I'm going to begin. So, yeah. Now, let me try this water thing one more time. I don't know where my bowl is, so, well, maybe it's in the sink. Just had it. Anyway, some little water here and there. And then I'm going to do my facial. So starting out for my facial, I'm going to cleanse the eyes. Oh, you can't even see what I'm doing. Cleanse the eyes and the mouth area. My book section. Okay, I had to make my little gauze. Alright, so I'm going to clean off and cleanse the mouth area. Okay, going outward, inward. And then I will go on the other side. And then the other side. And then I will swipe down at the eyes in a downward motion. And go outward, inward. And then sweeping it down with motion, outward, inward. Go this way. And then I'm going to take my cleanser and massage at the neck. And massage. And go up to the chin. And go up to cheeks. To the temples. To forehead. To the nose. And keep going. And then I'm going to cleanse again. But let me wet my hands a little bit more. And then cleanse one more time. Then I'm going to clean off the skin. Throws away. And then, sheesh. I want to make some lotion. So then it says, let me go ahead and analyze the skin by putting the what's it called? Gauze over the eyelids. Analyze to see for dry spots, oily spots, acne spots, all that good stuff. And then after I've skinned over the skin, I will remove. And then I'm going to tone the skin. And then, let's see. I'm not mistaken. Let me see. Anyway, so now I'm going to read over the procedure. It says photo rejuvenate treatments begin with a thorough cleanse of the skin area to be treated. Cover the eyes with goggles and moisten pad. Cover the thyroid gland to prevent accidental stimulation. And then the client should remove contacts. So let me cover the eyes. And then it says apply conductive gel. Apply often to reactivate the glide of the product. So, oh Lord, I'm about to spill water. So I'm gonna put gloves on. Put product over my client's face. And then, where am I going? Where am I going? Where am I going? Oh, do not press hard on the skin. Moving the probe too quickly, not keeping it flat on the skin or conductive gel will lessen the result. Use 2 minutes per pass for each section. This is essential for the appropriate penetration of light into skin. You may sweep the wand over the skin and hold it in one problem area. In treating clients with acne or other skin conditions, use combination of blue and red light. Cover the probe with a clear plastic film for sanitation and protect the probe. After treatment, use a moist towel on the face to gently remove any leftover gel. Then apply moisturizing cream with sunscreen. Use the light probes with the barber. You clean light probes with the barbicide wipes. Do not allow gel to dry on the probes. If it does, clean with the warm towel. Then it says standard 2-pass treatment. Divide the face into 6 segments. Right and left side of the neck and left side of the face, and right and left of the forehead. If you treat the décolleté, it is an additional section. What time is it? Then it says the recommended treatment begins with the jaw and the neck on one side and progresses to the cheek and forehead at the same time, and then down the face on the other side, forehead, cheek, neck. At each segment, you must put a minimum of 2 minutes carefully into the skin. Hold probe gently on the skin, trying not to lift it. Set a session time of 30 minutes for a full productive procedure. For full procedure. Slow circular movements and upward motion. Okay, so I'm gonna wipe my gloves off after I apply that gel. Then I'm going to get some saran wrap, wrap it around my LED lights, and then make sure my client's eyes stay covered. Where their eyes are going to be feeling like mine's right now, heavy. And then I'll start Maybe go a little bit slower. Don't forget the cheeks. Okay. My hand's starting to get tired. So, anywho, now I'm going to go ahead and remove the product off my client's face. And after that, I'm going to remove saran wrap, wipe off my LED lights with barbicide. And after that, I'm going to throw away my trash, put my LED lights up, and then what's next? If any leftover gel is on my client's face, I'll take a hot towel and wipe it off. What else? That's about it. So, yeah. So I think I'm good on that. And then I'm going to perform the microdermabrasion using my little markers. No, markers come in handy. Then I can do jet with my blue marker. And then hydro my green marker. So, now. Okay, and then after my LED, I'll go into the rest of my facial and go from there. So yeah, I think that's about it. And then I wish I had my paper for microdermabrasion, but I'm gonna just follow through with what I can remember. I know that that's going to be throughout my exfoliating process. What else can I do? Let's see. I think I'm good for now. I'm just going to go back into infection control, or I can go back into maybe I can do lifting. I just realized that I was getting myself confused with the tint and the lifting. So I can do lifting. And I'll read back over the instructions. And I'm going to actually go back into the bathroom and wash my hands, and then I'll start the lifting process. So I'll be back. I'm gonna wash my hands. Alright. So I wash my hands. My phone back on Do Not Disturb. And I'm going to go over the lash lifting. So, here I go. So for the lash lifting and the brow, it says it says greet client, escort them to your work area. Then it says assess the client's current style. This is for brow and lashes. It says determine the client's preferences. Assess client's needs. Assess client's skin by performing a skin analysis to ensure that there is no inflamed, infected, broken, raised, or swollen skin in the area to be worked on, or an open wound or sore in this area. Oh, am I reading it over? Hold on. All that just confused me. Assess client's skin by performing a skin analysis to ensure that there is no inflamed, infected, broken, raised, or swollen skin in the area to be worked on, or an open wound or sore in the area to be worked on, infected, infestation to prevent from safely performing service. Assess client's consultation form for any medications and products used within the last 72 hours. Consult on any known allergies. Consult with the client for any facial surgeries within the last 3 months and if the client under physician's care. Assess if the client's skin is prone to cold sores or fever blisters. Assess if the client has used exfoliating or lightening agents within the last 72 hours. HAAs, BHAs, hydrocortisone, etc. Assess facial injections within the last 3 weeks. If client is free from the above, move forward with the procedure. Excuse me. Wash hands. Also, next will be to wash the hands and then to set up the tools. So I guess I can wash my hands because my eyes are going crazy right now. Okay. So let's go to the bathroom. And then I'm going to wash my hands for 30 seconds. Paper towels are in here, so I'm just dry my hands on this towel. Oh, my bowl been behind the laptop this whole time. Alright, now let me get my water real quick. I got me a big old jug of water. Okay. Now, back to, oh Lord. Back to reality. Alright, anyway, so for my tool setup, it says gloves, headband, hairnet, headband, hairnet, headband or hairnet, cotton swabs, cotton pads, tissue, disposable applicator sticks, disposable portion cup / dish, disposable mascara wand, a lash perming rod or pad, products needed, eye makeup remover, lash or brow adhesive, lash or brow waving solution, neutralizing solution, water. Equipment needed, equipment cart, magnifying lamp, facial bed or hair. So for preparation, let me turn my heater up too, because it's cold again. So for preparation, it says disinfect workstation, bed, and equipment using a disinfectant wipe following manufacturer's instructions. Check equipment to ensure all devices are safe working order and plugged into a working receptacle. Dispense products needed for service. Prepare disposable portion cups for each product with a portion of product by opening the top of the container and ensuring the tip of the nozzle does not come in contact with the disposable portion cup, or remove product with disinfectant or clean single spatula. Close the lid to the product and set the portion cup / tray to the tray. Drape facial bed using one fitted sheet, one flat sheet, and 3 towels. Place clean, laundered sheet on disinfected facial bed, placing a towel horizontally at the head of the bed. Lay a hairnet and a headband on top of the towel, along with a rolled towel to support the head and the neck of the client. Save the third towel to lay across the client and décolleté, or use disposable table paper to drape the bed. Client preparation. Help client onto bed. Place the hairnet and the headband on the client's head to cover the hair and ears completely. Place the rolled towel under the client's neck to support the head of the client. Washing hands procedure. Just did that. I don't feel like getting back up. And then service performance. Identify permanent products to be used and read manufacturer's instructions for next year usage. Determine the size of the roller desired for the amount of lift to be achieved if applicable. Apply gloves. Apply cleansing product to the eyes and the lashes. Okay, I lost myself for a minute. Towels. Okay, I'm getting lost in la la land. So I'm going to. Whew, sheesh. Okay, so now I'm going to apply cleansing product to the brows and the eyes. I place iPads on my client's face, and then it says, retrieve cleansing product from disposable portion cup with the disposable spatula and apply 2x2s with eye makeup remover. Place the iPads to the client's eyes. Use moistened makeup remover. Use a 4x4 with a moistened makeup remover to remove brow color. Hold opposite side of the brow with the thumb with your free hand. Apply firm pressure. Remove brow color from the outer corner to the inside. Bottom corner. Your inside. Oh, you can't see. Throw this away. And then I'm going to do the other brow. Put that away. And then sleep down the lashes. From the outer corner to the inner corner. Sweeping down. Outer to inner. And then I'm going to do pat it dry. Repeat step on the other brow. Double brace while wiping the eye area downward. Did that. Application of protective petroleum jelly. So with gloved hands, dispense protective cream or Vaseline by opening the container and ensuring no contamination of the container. Using a spatula, apply a small amount of product into the product cup. Close the top of the container. Please place the used spatula into your disinfectant container. Instruct client to keep eyes closed at all times. Ensure lashes and brows are entirely dry before proceeding. So, I know I got a little Q-tip, something right beside me. If I can find it. Oh Lord, wrong one. Ow! Let me see. I got a Q-tip somewhere right here. Oh. Whew, Jesus. Now, oh. So I got the Vaseline. So my gloves are on my hands. And I'm going to put Vaseline around the brows. Then I'm going to take some more and put it under the eyes. And put my little pads, eye pads at the bottom. Then throw this away. Then I'm going to put some pads on the bottom to protect the eyes. It is so cold, like even while the heat is on this cold. um, Carefully place a damp cotton pad on the lower lid on top of the protective cream to prevent fumes from entering the eyes and protect the skin from the product. Bend the roller slightly to conform the shape of the eye. So for my rollers, I'm just used tape to improvise. So this gonna be my little rod to put across the eye. And then excuse me. Um, Let me get a blanket because I'm freezing. It says discard applicator. Oh wait, hold on now. Gently place the primer rod the base of the upper lashes. I did that. Carefully use disposable applicator to press against each lash. Oh, okay. So I'm gonna bend my lashes back like I did last time. I'm gonna get my blanket because I'm freezing. Oh shoot. Okay, and then I'm gonna take some tweezers or something and start rolling the lashes along the eye. Let's see. Okay, so I got my tweezers. Okay, so I'm going to do these sharp ones. Okay, so now I'm going to, where's our wrong part? So now I'm going to take my little waving solution and just lay my lashes out across the roller. Oops, I done pulled the lash out. So now I'm just laying the lashes across the roller, trying to smooth it out, make sure that they're pulled directly going up so that they don't bend. I'm gonna spit some water. It's okay though. And then I'm gonna go to the other side and lay it out. So I'm gonna keep laying it out smoothly. And so once I continue to lay that across, the next step it says discard applicator and waste receptacle. Verify the number of the lower lashes are on the pad. Carefully apply the permanent solution to the lashes to adhere the roller or rod, avoiding the skin and following manufacturer's direction. Dip cotton swab or brush application into the waving solution. Remove excess from the cotton swab or brush applicator. Carefully apply waving solution to the lashes in upward motion until lashes are evenly coated. Ensure not to get the product in the client's eyes, nose, and mouth. Process according to manufacturer's directions. So I'm going to take another cotton swab and a cotton swab or applicator and apply product across the eyelid. So I'm just putting all the waving solution on my client's lashes. So after that, I'm going to remove waving solution with the wet cotton pad without dripping water in the client's eyes. Whew. Moving in a downward motion with a light hand, remove the waving. Upward motion. I was about to say, I know it's not downward. At least 3 times, so. Okay. Then after that, what's next? I keep losing my spot. Remove under iPads in in the waste receptacle and replace with new iPads if needed. Then it says sorry. Carefully apply neutralizing solution to the lashes that are securely adhered to the rod, avoiding the skin, and following the manufacturer's direction. Dip cotton swab or brush applicator into neutralizing solution. Remove excess from the cotton swab or brush applicator. Carefully apply neutralizing solution to the lashes in upward motion until lashes are evenly coated. Ensure not to get product in client's eyes, nose, or mouth. Process according to the manufacturer's directions. So I'm going to put solution on my client's lashes. Not with this in real life, but this is what I have for now. Okay. And then once that's done, dip cotton swab or brush applicator into neutralizing solution. Remove excess from the cotton swab or brush applicator. Apply neutralizing solution to the lashes and upward motion until lashes are evenly coated. Oh, I already did that. Remove neutralizing solution with the wet cotton pad without dripping water into the client's eyes. Move in an upward motion. With a light hand, removing neutralizing solution. Then, after I'm done wiping that off, it says slowly roll lashes off of cotton pad. Remove protective eye pads from over the eyes. Discard protective eye waste receptacle. Use a cotton pad and moisten with makeup remover to cleanse the eye area. So I'm going to take the lashes off of the rod. So removing the lashes. Do not pull. They should gently come off of the roller. And it says, carefully place the cotton pad below each brow on top of protective cream to protect the skin from the product and catch any excess solution. Gently use mascara wand to comb the brows up into the desired shape and pattern. Carefully apply the lash and brow adhesive using applicator recommended by the manufacturer. Oh, okay, so not of a mascara wand. That's not it. So I'm gonna comb the brows up into desired shape. And then sorry, I'm losing my train of thought. And I look bad. Now I'm gonna apply the lash adhesive or brow adhesive using the applicator as recommended. Discard and carefully apply putting solution. So let me go ahead and put the adhesive. Okay. And then carefully apply permanent solution to the brow, avoiding the skin and following manufacturer's directions. Excuse me. Dip cotton swab or brush applicator into the waving solution. Remove excess. Excuse me. Remove excess from the cotton swab or brush applicator. So let me do this. Apply permanent solution. Of brow going up. And then dip a cotton swab Okay, so remove excess from the cotton swab or brush applicator. Carefully apply waving solution to the brows in an upward motion until brows are evenly coated. Be sure not to get in the client's eyes, nose, and mouth. Process according to manufacturer's directions. Remove waving solution with a wet cotton pad without dripping water in the client's eyes. Move in upward motion with a light hand. Remove waving solution. Repeat at least 3 times to remove all waving solution to brow area. Discard used cotton pads and waste receptacle. Remove. This is so tricky to me. Remove used under eye pads and discard in waste receptacle and replace with new eye pads. Carefully apply neutralizing solution. So let me remove the waving solution going upward. Then it says oh shoot. It says take this process. Wait. Carefully apply neutralizing solution to the brow, avoiding the skin and following the manufacturer's direction. Dip cotton swab or brush application to neutralizing solution. Remove excess from the cotton swab or brush application. Carefully apply neutralizing solution to the brows in upward motion until brows are evenly coated. Ensure not to get the product in the client's eyes, nose, or mouth. Okay, so neutralize the solution. With my mascara wand, I'll brush going up. Sorry. Then it says, oh, my other alarm is probably gonna go off. Let me turn this off. Oh yeah, definitely was gonna go off. Then it says, where was I? Okay, so I applied the neutralizing product to the brow. Dip cotton swab, remove excess cotton swab, carefully apply, process according to manufacturer's directions. Remove neutralizing solution with a wet cotton pad without dripping water into my client's eyes. So, now I'm going to move in upward motion. Then it says, remove protective eye pads from under the eyes. Discard. Use a cotton pad to wipe under the eye area. So, I'm going to clean under the eye. And right brow area in an upward sweeping motion to clean the brow. For 3 passes, take caution not to pull or tug. Ouch. So, upward. Go away. What's next? Post service. So after I've done the tint and for the lashes and the brows, it is complete. Afterwards, I'll follow up with my client, throw away my trash, what's next? Place implements in a used container to be disinfected. Place cape and towels in the container, closed container to be laundered. For my work area, I will identify proper cleaning agents and read the instructions. Follow the instructions for mixing and usage. Identify disinfectant that is bactericidal, virucidal, and fungicidal. EPA approved for use in small setting. Follow manufacturer's directions for mixing and using appropriate aerosol. Disinfectant equipment stored in the clean area separate from implements. Remove gloves, wash hands. So now I'm going to straighten up. Take this blanket off me. I'm going to straighten up and sorry. Oh, goodness gracious. And let's clean my workstation. Now I can clean up and go and wash my hands, and I got paper towels and stuff everywhere. Okay. So now go to the bathroom so I can wash my hands. So wash my hands. Okay, turn this water off. Get my drummer hands. Get some water. Whew. I feel a little better. Just a little bit. So, I got some stuff right here. Alright, now, oh shoot. Now I'm going to go ahead and get into infection control again. And it's cold. Anywho, so I'm going to get into infection control again, starting from washing hands, implements, first aid, and yeah, so now I'm going to do my hand washing again. So I'm going to turn my water on. Oh, I need my paper towel. Alright, now I can wash my hands. For 30 seconds. Back in my hand. Wrist. Wrist. Hand. Hand. Oh, so palms. I'm sorry, palms. The back of my hand. In between my fingers. Under my nails. Where my hands are. Oh, and my thumbs. Two thumbs. And thumbs. Shake, shake, shake. Turn the water off. Throw it away. Then that's it. Hand washing method. Now I'm going to do my what's it called? My implements, and I'm going to take my tweezers and I'm going to wash them off. And wash them off with my solution. And squirt them off. And washing and washing and washing. And I'm going to take this. Dry it off. And after I rinse, I don't think I said the part about my container being filled with water, but it was filled with water and I'm gonna take it out and rinse that off as well. Then I'm gonna get my gloves, and with my gloves I will continue to with my gloves I'll take my gloves and my goggles and get my barbicide and my measuring cup. And I will fill my container back with water, warm water. So container filled with water. Then I'm going to take my measuring cup, fill it up with the barbicide, 2 ounces of barbicide, and pour it into the container. Then I'm going to put my implement inside and close it and set the timer for 10 minutes. Then I'm going to take barbicide wipe and wipe off my sink. Okay, then I'll throw away my gloves along with my barbicide wipe and wash my hands again. Okay, alright, then I'm done. And then I'm going to do licensing injury. And I'm in between the client, well, not in between, but I'm with the client, and I accidentally hurt myself. I'm going to tell them to remain calm, and I'm going to go to the sink and wash my hands. So wash my hands, and then I wash the room just on my hands. Rinse it off. Clean my hands off. Next way. Then I'm going to take Q-tip, cotton swab, whatever, and look for my antibiotic cream. And I'm going to apply, well, with the cotton swab, apply my antibiotic ointment on my hands. I'm going to take my gloves and my barbicide. And wipe off my marker. And wiping off my work area. And then I'm going to take off my gloves along with throw my barbicide, wipe away, and wash my hands without getting the room wet. Then I'll take my paper towel, dry my hands, and boom, that's that. And then I will return back to my service. So now I'm going to go ahead and do my microdermabrasion for the next video and some of the jet peel. And yeah, so I'll be back. And